My name is Amisha Wallia. I am a physician scientist and an endocrinologist here at Northwestern Medicine. There are a lot of barriers for patients with diabetes in federally qualified health centers and in other areas in obtaining and accessing continuous glucose monitors and various other types of diabetes technologies. There are barriers at lots of levels, but the exciting part is the technology. Even in the last couple years, from both the clinician side and on the patient side, be able to see the day-to-day fluctuations in blood sugar and be able to see, okay, this is what happens with exercise, this is what happens with eating, movement and initiative to overcome these barriers so that we can utilize these technologies to improve diabetes care. There are unfortunately great disparities in technology use, such as continuous glucose monitoring. Some of the work that our group has shown is that those who self-identify as Black or Hispanic have much lower rates of obtaining and filling continuous glucose monitors in their day-to-day life, and that includes both patients with type 1 and type 2 diabetes. The factors that contribute to these disparities we believe are multifactorial, and we're still trying to understand them. Of course, insurance coverage is a big barrier and can vary widely from state to state. Interestingly, the barriers seem to be similar regardless of type of diabetes and can be localized to many different factors that could be patient-driven or clinician-driven, but also perhaps system-driven, like we said with insurance. So I think on the individual level, what's really important is, trying to stay up to date on the technology that's available and how to use it, let's say for a clinician, and then working really with your healthcare system to say, how am I able to look at this data within the EHR or separately from the EHR, but get the data in. I also think that any person that touches the healthcare system and like the patient with diabetes can be an advocate for being able to also help the patient understand about the technologies that are available and if it's right for them, and being advocates for the patient to ask the questions about whether that technology is right for them. There have been some great strides in patients specifically with type 1 diabetes who have had access to continuous glucose monitoring for a little bit longer time than patients with type 2, and those include quality improvement initiatives where the diabetes team or other teams will work closely with, example, the quality improvement department to try to improve access. I think those types of studies need to be replicated and actually tested in larger populations to see if they'll be applicable to patients with type 2 as well. I think it's a really exciting time and that lots of interest in the area to see how we can improve the use of these technologies. I have been in the diabetes field for a long time, and fixing this problem is critically important because diabetes is a disease that touches so many people and so many lives in so many different ways, and we may not even know it. It's somewhat of a silent disease, and I think that making sure that our patients have the access to the best types of care available to help them make decisions on a day-to-day basis about their blood sugar has really lasting impacts on quality of life and has potentially great ability to decrease healthcare costs as well downstream. I think Northwestern Medicine has definitely identified that this is a critical issue and has really put in the resources needed to help start us to think about integration within the electronic health record, but also help our clinicians from all over, especially let's say primary care, to figure out how do we utilize continuous glucose monitoring and how can we improve the care